Hello and welcome. My name is Jody Towns from Cypress Membership Medicine. I will begin our informational presentation with an introduction of Dr. Milli Santorufo. Dr. Milli is a board-certified family physician in osteopathic manipulative treatment. Her fascination with science and medicine began at an early age. She knew she wanted to be a physician at the tender age of 3. Dr. Milli received her Master's of Science degree in Biomedical Science from Barry University and Doctor of Osteopathic Medical degree from Nova Southeastern University College of Osteopathic Medicine. She is a member of the American Osteopathic Association and the American Academy of Family Physicians. Dr. Milli is the medical director of Real Results Medical Weight Loss in Kennesaw, which is also home to Dr. Milli's Medical Wellness Center. So now I will turn it over to Dr. Milli to share more information. Welcome, Dr. Milli.
Well, thank you so much, Jody. I appreciate it. Thank you for having me.
Definitely.
So I'm really excited today to talk about my new practice. And first, I want to give you some background as to where my decision to do this came from. And it came primarily from a lot of the changes that have happened in healthcare and the direction that healthcare is going, which is unfortunately not in a very good direction. We all know that our premiums continue to rise. They're almost double. In the last few years, they just continue to skyrocket. Drug costs have gone up dramatically in the last few years. Hospital costs continue to rise. And as a result of all of these factors, we find that the amount of physicians out there and providers are going down, and there's not as many providers to take care of the increasing number of patients. And so when there are fewer doctors and more patients, you find that the doctors have and the providers have less time to spend with patients, and that's where you wind up getting 5 minutes and you're told you can only have so many issues to discuss. And I've just decided I would like to try to work outside of those situations as much as possible and get back to where medicine began, and that's that patient doctor relationship. So in order to get to that place again, there's a new way of looking at healthcare where it gets back to trying to prevent disease and getting ahead of disease before it becomes an issue. I'm not a fan of just treating symptoms or just throwing medications at issues. I want to try to find out what the underlying cause is of the problem and fix it. And even better yet, if we can do the more advanced screening and preventative care to get in front of it before it even happens, that's all the better. But that takes time. And that's not something that we can do in the old model. And so that's where this new model of healthcare works really well. And so what is the model? We call it personalized healthcare, membership medicine, concierge medicine. And basically it's getting back to that patient-doctor relationship where I can spend more time with the patient and really delve into issues deeply and answer all your questions and take the time to investigate things more thoroughly. And again, do some of those special preventative testing or screening tests so that we can avoid illness in the future. So the major components of membership medicine or personalized healthcare is the time, the relationship between the doctor and the patient, and because I will have fewer patients, being able to more easily communicate directly with the patient. There's no more third person where you have to talk to my nurse and then, we go through a series of conversations and there's things lost in translation. If you need to speak to me, You can send me a message directly, you can call me directly, you can come in to see me, you can have a televisit, and it's just between us and no other individuals involved. So the benefits of this type of practice is, again, having that direct contact where literally you will have a direct phone number to me where you can get in touch with me day or night, weekends, at any time. You will have much longer appointments. The physical, which we're really talking about in a second, is a 2-hour physical. All your follow-ups are at least an hour. Even your acute or sick visits are half an hour. So we really get to go through all of your questions, really go into detail with going over your results and discussing options. The executive physical is something that I'm really excited about because it's something that I'm really pleased to be able to offer, since usually the physical that you're allowed to have through your insurance is somewhat limited. And with the executive style physical, I get to do some of those additional exams, such as advanced lipid panels, where we're not just looking at your cholesterol levels, but we're looking at your inflammatory markers, and we're looking at some of your genetic markers and some of the particle sizes. And it really gives us a bigger, better picture of what's going on. It also allows me to do certain screening tests that I would not otherwise be able to do because insurance doesn't pay for them. So it's really, it allows me to do a much more thorough investigation and get more information so that we can find stuff at a much earlier point. The other thing that I get to do as part of this, since I have more time, is I have a real passion for bioidentical hormone therapy. And a lot of patients do have issues with female hormones, low T, thyroid issues, adrenal fatigue. And often in a regular primary care practice, there's not time to really get into that. And even some endocrinologists don't have the time to delve into that. And I'll be able to really go into that in more depth. And a lot of times that doesn't even necessarily require prescriptions. There are other things that we can do with supplements or with other lifestyle changes that can help with those issues. And so that's the benefit of having this time in the smaller panel. The other thing is, because I have the smaller panel, I can also directly communicate with any of your other specialists and physicians and make sure that nothing does drop through the cracks or gets missed or overlooked. I have the time to go through those reports in detail and make sure that something didn't get missed, or, oh, by the way, did they mention this to you? And anyone that knows me knows that I'm known for being extremely thorough and very detail oriented, and this will allow me to really even do that further. One of the other nice things that we are able to do with the particular membership that we have is if your parents, if as adults you sign up and you have a dependent child, they're included in the membership at no cost. Whereas there are, and certainly that is helpful for your students that might be away at college, and it's more difficult for them to get to see a physician because they may be several hundred miles away from you. And this is a situation where I can get on the computer with them and they can tell me what's going on and I can take care of it, and you don't have to be worried at home that what's happening with your child, however many hundred miles away. The other aspect of the membership is that the area where I'm located in this office suite, again, I'm the medical director of a program called Real Results of Kennesaw. And as part of the executive physical, you also get an evaluation with Jamie Young, who is the woman who does the medical weight loss there. And you get a full in-body and nutritional assessment, and she can give you some recommendations. There's no obligation to utilize her services, but it's another piece of information that you can then use to help make decisions. There's also a personal trainer in the suite, And she is also able to do a brief fitness evaluation and to make recommendations in terms of that as well. So you really get a very full evaluation from all perspectives. And then we can all collectively give you a plan to help redirect your goals and make this a much better year than 2020 was. So the big question that most people have is, it's all well and good that, okay, it's a membership practice and I have all the benefits of it and I know what the annual fee is, but how does it work in conjunction with health insurance? And what it comes down to is you still need to have health insurance, because I can only control the cost of things that are within my office, but there are always going to be additional labs or imaging, or if you have to see a specialist, that still would have to go through your insurance. If you need to go to the emergency room, if you needed to be admitted to the hospital, if you needed a surgical procedure. So you still have to have insurance. And at this time, I'm in the process of getting credentialed for insurance. So at some point, you will be able to also utilize your insurance here. You cannot submit the executive physical to your insurance. You cannot submit your membership through insurance. But for any of your regular follow-ups, you still can utilize your insurance in the same way that you would at any doctor's office. And again, some folks may look at the cost of the membership and try to determine if there's a value there. But when you really break it down, it really isn't much more than what you probably, pay if you run through Starbucks, in the morning, or if you were to look at, your cell phone bill or your cable bill, and really started to dissect it out. If you broke it down, you would see the value in it, especially anyone that's ever had to take time off to go to their doctor and then spend 2 hours and only get 15 minutes, or couldn't get into their physician and then had to go after hours to the urgent care, and your deductibles higher for that visit. In the long term, you ultimately see that you probably it's worth its weight in gold for the ease of access that you get. So the membership fee is $1,800 for an individual. There is a slight reduction for a couple. It's $3,300 or $1,650 per person. Those payments can be made annually, semi-annually, or quarterly. Again, that's in addition to your insurance. That's a separate thing entirely. And again, because this is a membership practice, space is limited. I'm keeping the panel size small. So you want to make sure that if this is something that you think you might be interested in, that you definitely get in touch with us as soon as possible, because once we reach that magic number, then there'll be a waiting list, and we'll go from that point. So if it's something that you're really interested in, I suggest you definitely get in touch with Jody as soon as possible. And so now Jody will tell you exactly how to contact her and get signed up.
Yes, thank you, Dr. Milli. And for those of you who are watching this recording, I'm sure you're very excited after hearing from her and hearing more details about what she's going to be offering. We do want to keep this as easy as possible for you. And just as Dr. Milli mentioned, we want you to act as quick as possible before we have to actually create a wait list. So again, keeping it very simple. You can do this online from your own computer as far as the sign up. You will just go to the website yourcypress.com/Dr. Milli. And from that website, you'll go to the upper right-hand corner, and there's going to be a join now. You'll click on that, and that will take you into the application process where you'll be able to do the sign up, provide your payment information, and get your spot secure. So we definitely encourage you to do that as quick as possible. If you do have any further questions, or if you'd like to do the sign up process over the phone, I would be happy to help you. You would just call me at 404-905-7809. And again, I'll be happy to sign up anybody over the phone or even answer any of your additional questions. So before we wrap up, we do have a few commonly asked membership questions. So I would like to move to that. And some of this information Dr. Milli has already mentioned, but again, these are common questions. So we will start with the first one, which is, will my HSA or FSA cover part of the cost of membership?
That is a very complicated question. And basically, I would recommend that you contact your insurance company directly. Um, there may be some that will cover it, but I would have to say that the vast majority of the time, it's typically not something that you can apply your HSA or your FSA for. But you should consult with your own individual insurance agent or company for a more definitive answer.
The next question, how does this work with my insurance as well as copays?
Yes, and so as I had mentioned, I'm in the process of being credentialed with insurance, and so basically, once I am in a network provider, it would be the same as in any practice that you go to. When you come in for any type of regular visit, a follow up, a sick visit, anything like that, I would submit the visit to your insurance just as any other office would. You would be responsible to pay your copay. If you have a co-insurance or you haven't met your deductible, you would be responsible for those things. The only distinction is that the executive physical is a separate entity that is taken care of through your membership, and so that I would not be submitting to your insurance company.
How many patients are you taking in this new practice, and what happens if you reach capacity?
Well, I have a number in mind for where I think I would ultimately like the practice to be. Um, and I'm thinking it's going to be somewhere around the 3 to 350 number. So that's a pretty low number. So, once we reach that point, then we would start a waiting list, as we had mentioned before. So, you definitely, if it's something that you think you might be interested in, you want to definitely make sure that you get in touch with Jody as soon as possible.
What happens if you go on vacation?
Ah, that's a wonderful question. So if it's for the most part, if you have an emergency situation, regardless of whether I'm here or not, certain things still require going to the emergency room. If it is a more non-urgent issue, as long as I'm within contact, I have cell service and I have internet, I can still pretty much respond to your questions, your calls, and address any issues that come up. And typically, prior to going on any type of vacation, I would give everybody very well advanced notice so that we could anticipate and try to make sure that everything was taken care of prior to my leaving. Um, but if it were going to be for a more extended period of time, or if I were to say be somewhere where I might not be within communication means, then I would have a physician that would cover for me during that time period. But I don't foresee that being an issue, at least not in the near future, particularly with COVID. There's not much traveling or anything going on. So I don't see where I wouldn't be able to still field calls during that time period.
Okay, and then this is the last question. Will you raise your fees?
So for anyone that signs up right now, your fee will be locked in, as it were, for the next 3 years. But at any point, during the next 6 months, a year, I could decide to increase my fees, and for the new patients, they would then start at that level. So all the more reason that if this is something that you're interested in, you should do it now while it is at this level. And this way you lock that in for at least the next 3 years.
Great. Well, thank you again, Dr. Millie, and thank you to everyone who's taken the time to watch and listen to this recording. Again, we look forward to hearing from you. We look forward to your membership. And just as a reminder, very easy sign up. Just go to yourcypress.com/Dr. Millie, and you will just complete your application under the Join Now button. So again, thank you, Dr. Millie. And
Thank you.
thank you everyone for watching.